Good morning, Becky Thorson, midday Okabudgie. Time for Becky's Business Beat. And joining me today is Nikki Steen, Program Director with the Wound and Hyperbaric Healing Center in Windham, Minnesota. Hi, Nikki.
Hi, Becky. Good morning.
Good morning. You know, you treat all kinds of wounds there at the Wound and Hyperbaric Healing Center, but you're going to start talking a little bit about those diabetic wounds and tell us about how those wounds come about.
People with diabetes are more at risk for wounds. Sometimes it has to do with the blood flow down to their legs and their feet. It also can deal with sensory neuropathy, where people with diabetes can't feel their feet or their limbs as well. And when you can't feel them, if you would, say, step on something sharp like a toothpick or a tack, they may not feel that. And, several days later, a wound develops and they can get it infected very quickly and turn into a big wound.
And then it's difficult to heal when they already have diabetes, is that right?
Yes. When someone has chronic health problems such as diabetes, it takes the body more time and more resources to really try to heal a wound. They're very difficult to treat sometimes.
What do you do there at the center to help with the healing process?
We use a lot of our state-of-the-art therapies where we look very closely at their vascular status, if this wound is getting flow. We look at offloading pressure, because pressure can also make wounds worse. And then on those diabetic wounds, we can look at special wound dressings, bioskins, and of course our hyperbarics treatment is indicated when people have very severe diabetic foot ulcers.
And that's very effective, isn't it, the hyperbaric chamber?
Yes, the hyperbaric chamber is a wonderful addition to chronic wound care. Hyperbarics, it takes that oxygen and puts it under pressure and pushes that oxygen into the body, deep into the tissues and the bloodstream and the plasma. And once it gets in there, it works its magic, and it can help to heal that wound from the inside out.
Well, I understand it's Diabetes Awareness Month coming up, and you'll have some special information for people with diabetes.
Absolutely. We know that 25% of the population of people that are over 65 have diabetes. And of those people, 2 million people have diabetic foot ulcers. So the prevalence is out there, and it's a very serious wound, and we are certainly here to help those with that kind of need.
Yeah, that's just great. And of course, they could be referred by their physician to you, but they may also contact you directly right there.
Absolutely. Patients can self-refer. They can be referred from diabetic educators, surgeons, primary physicians, and we're very easy to reach. Our phone number is 507-831-0686.
And lots of information online as well.
That's correct. We are www.wyndhamareahealth.org.
Okay, great info there, and easy to find right there at the hospital in Windham.
Yes, we are.
Okay, and get those wounds starting to heal there with that expert help from the Wound and Hyperbaric Healing Center. Thank you so much for sharing that information with us today, Nikki.
Thank you so much, Becky.
There's Nikki Steen, the Program Director with the Wound and Hyperbaric Healing Center in Windham, Minnesota. See more details at wyndhamareahealth.org. It's Becky's Business Beat on Campus Radio, KUOO.